Over the years, I feel grateful to have been in the care of some really great psychiatrists. They've helped to transform my life, and I feel better now than I have for decades. So I'm very interested to meet you today, 4 psychiatrists, all at different stages of your careers. I'd like to ask about what it is you love about psychiatry.
I think it's a really interesting job, really get to know my patients and their families and really get to find out about what's happening for them in their life and hopefully do my best to help them develop into adulthood.
Speaking with someone who's in established recovery is just such a joy to hear about how they've done it, how they maintain it and the transformation that it's made to their lives.
Working in intellectual disabilities, I feel like I work with a very stigmatised or marginalised group, and I like working with that particular group of patients and their families and seeing how they improve.
I find a great deal of satisfaction working with older people, and I guess these group of people, because they have so many comorbid physical illnesses, that their mental health is overlooked. So working with them, it gives me an opportunity to actually make a real difference in their life.
Okay, I know that you work as a team, so could you tell me a little bit more about what's involved in that?
Everything we do is based around the multidisciplinary team, so we will work as psychiatrists with nurses, with social workers, with psychologists, also with alcohol and drug workers. And one of the things that's really important in addiction psychiatry is that we work very closely with experts by experience.
Yeah, I think it's the same in child and adolescent psychiatry. We work very closely with education and occasionally social care as well. So it's a real mix of people working with the team, working with other agencies.
Bouncing off ideas with other team members, it gives us a different perspective and what we can do to make a change in our patient's life.
Yeah.
And I think that's something I really like about psychiatry as well, that you never really feel isolated when you're working.
Okay, can you tell me about your speciality within psychiatry and why you chose it?
Last year I worked in old age liaison and I really loved that job. You can see the passion on my face, like basically you learn quite a lot from them.
Yeah.
And also like because they have so much going on in terms of their physical health, you have to keep all the learnings from the medical school on the top of your mind.
I think I really like the variety and the flexibility. The inpatients that I work with, they're from the ages of 13 to 18, children at various different stages of their development. You get to work with young people with eating disorders, with mental illness, with emotional and behavioural problems, or neurodevelopmental conditions such as autism or ADHD.
The training scheme that I was on as a junior psychiatrist had a placement for a junior psychiatrist in addiction psychiatry. And once I did that placement, I just, a light bulb went on and I realised that that was a specialty for me.
I'm intrigued when you said the light bulb moment that you had. Can I ask more about that? What the light bulb moment was?
It was just a field of psychiatry that I didn't know anything about before I did it. So once I understood what was possible, that actually hope and optimism are realistic ways to go about your daily life in addiction psychiatry was great.
Yeah. I mean, is it the variety, do you think, that attracts all of you, the fact that there is so much variety in your jobs?
Definitely. So I have colleagues like who work part-time, so it gives a good work-life balance.
As an intellectual disability psychiatrist, you can work in the community, you can work in an inpatient job, you could take on a forensic unit like the one I'm doing now. You can really pick and choose what you like to do, which I really like, so flexible.
Yeah, I think flexibility is a real big thing in psychiatry, I think across all specialties. There might be some days, for example, if you're doing your research day, you could work from home. There's less than full-time options.
And it seems like essential to get the work-life balance correct so that the patients get the best of you.
Yeah.
Thank you very much for sharing all that with me.
Thank you, it's been a pleasure.